a very important, potentially life-threatening condition called meningitis. Before diving into meningitis, let's first understand the anatomy of the meningitis. When we talk about the anatomy of the meningitis, it consists of the 3 layers which protect and support the brain and then the spinal cord. These layers or these membranes include the following. We have the dura mater, which is the outer layer of the membrane. It protects and supports the brain and then the spinal cord. We have the acnoid mater, which is the middle layer of the membrane. They also protect and support the spinal cord. We have the perimeter, which is the inner layer of the membrane, which is also protect and support the brain and then the spinal cord. So I will write it and then we all see together. So we have the dura mater. This one is the outer. So this is the outer layer, and then you have the acnoid. You have the acnoid mater or matter, which is also the middle. This one is the middle layer. And then we have the perimeter or the perimeter, which is the inner layer. I said no, obi be kind of matter, obi be so be kind of matter. Is the same thing. So these are the 3 membranes that covering the brain and then the spinal cord. They protect the brain and the spinal cord. Now, if these membranes get inflamed due to infections, then it puts pressure on the membrane, or it puts pressure on the brain and the spinal cord, leading to meningitis. So the anatomy of the meningitis is that there are 3 layers, which is the dura mater, which is the acnoid mater, which is the perimeter. All these membranes protect and support the spinal cord and the brain. But here is a situation where there is inflamed due to infection. Then it will put pressure on the brain and the spinal cord. As a result of that, it will lead to meningitis. Now, what is meningitis? Meningitis is the inflammation of the meninges. That is the protective membrane covering the brain and then the spinal cord. The causes of meningitis is as a result of bacteria, is as a result of virus, is as a result of fungi, is as a result of parasites. But note this, the bacteria is the most severe life-threatening infections of the meningitis. I'm repeating it again. The bacteria is the most significant life-threatening infections of the meningitis. Now, let's go to the signs and symptoms of meningitis. We have fever. There will be high body temperature. Body that is high body temperature. We have severe headache. Now we have stiff neck. We have nausea and vomiting. Confusion, disoriented. Now bones are confused. Sensitive to light. Bones say light now bones say so how can we diagnose? How can we diagnose meningitis? 1. Clinical assessment such as nausea, vomiting, fever, headache. These are the clinical assessments. We have laboratory tests, blood test. So we need to look for increased white blood cells. If there is infections in the increased white blood cells, we need to also have imaging study, CT scan and then MRI. So the CT scan will detect whether there is infection. The MRI, which is the magnetic resonance imaging, they are going to detect if there is infections in the soft tissues, there is infections in the ligament, there is infections in the cartilage. So these are how we can diagnose, or how meningitis is what? Diagnosed. So what are the treatments? The treatment is based on bacteria, virus, and then the fungi. I'm repeating it again. We have bacteria, virus, and then the fungi. So the bacteria, you have medications there. You have IV antibiotics such as ceftriaxone and ampicillin. These are the bacterial meningitis, the medication that you can use to treat bacterial meningitis, ampicillin, and then the ceftriaxone. We have the virus, you can give antiviral medications. You also have the fungi, you can give IV anti-fungi medication like the drug that you can use to treat fungi meningitis or fungal infections in meningitis. So what are the prevent strategies? 1, vaccination. You need to get a vaccine. You need to get a vaccine. It's tiny vaccine. You better say, "Aya vaccine baby because a boost the immune system." So if any foreign materials be a they will kill all these foreign bodies or infections ahead. Everybody. I feel so good hygiene practice. Charlie, who did you and your man who come? Proud them. Dimun said there be a unya meningitis. I feel so earlier treatment of infections. Into when your meningitis. Yes, we didn't kind of say earlier treatment is very, very important because say it's a bit may lead to other complications. It will not help the body. So the statistics now our Ghana had on February 16, 2025. The statistics was 120 cases, but our West upper region called a hopa na yare a friend meningitis a hopa and a emu systems right there. Indeed, you best say, Yamoya Hubai, every yare a friend meningitis. So, as a nurse, what is the role in managing meningitis? As a nurse, I am a nurse. So, what are my role in managing meningitis? 1. Monitor vital signs. And vital signs need you need to check the body temperature, the blood pressure, elevated pulse, respiration, SpO2, and all the vital signs. You need to check all of them. Assessing neurological status. You need to also assess for any neurological status. Encourage vaccination is also one of the roles in nursing. You need to check for ICP. That's one day we can ICP only the crime making. Increase intracranial pressure. Increase intracranial pressure. And then we have risk factors. The risk factors, it is divided into 2. We have modifier.
Guys, you are welcome back to Nescafe TV. This is episode 2 of After Uni What Next with Mr. Richard Alupin, a man who has the intelligence, and was high by IT mind, and was very, very high. So, Senior, you've talked about a lot of things, but now what I want us to talk about here, the strategies that you can give to young graduates. The strategies that you can give to young graduates.